Imagine waking up in the middle of the night with the sensation that something is crawling beneath your skin. You turn on the light, examine every inch of your body, but find nothing. Yet, the itching persists, accompanied by an almost impossible to explain terror. For those suffering from Ekbom Syndrome, this is not an isolated experience. It is everyday life, also known as delusional parasitosis. Ekbom Syndrome is a rare and devastating psychiatric disorder. In it, the person believes they are infested with insects, worms, or other parasites, even when medical exams prove otherwise. The sensation is not just imaginary. Many patients claim to feel bites, movements, or even the physical presence of tiny bodies under their skin. This tactile experience is so intense that, for them, denying its existence seems impossible. The name comes from the Swedish neurologist Carl Axel Ekbom, who, in 1938, first described cases of patients, mostly women, with absolute conviction that they were infested by invisible parasites. What makes Ekbom Syndrome so cruel is the combination of physical perception and unwavering belief. It is not just an idea. It is a real feeling that defies logic and science. Many patients end up harming their own skin, trying to extract the supposed parasites. They scratch, cut, and apply dangerous chemicals, imagining they can clean their body of something that, in reality, does not exist. In some cases, these wounds become infected, creating an even crueler cycle. Damaged skin intensifies the itching sensation, which reinforces the delusion of infestation. The syndrome can arise in isolation or be associated with other mental disorders such as depression, schizophrenia, and obsessive-compulsive disorder. It can also appear in cases of drug abuse, like cocaine and methamphetamine. Interestingly, some studies point out that neurological changes, as in Parkinson's or Alzheimer's diseases, can trigger the condition. In these situations, the brain misinterprets normal stimuli, creating the sensation of movement under the skin. The emotional impact is profound. Many patients isolate themselves, avoiding physical contact with family and friends, believing they might transmit the parasites to others. Some even move houses, throw away clothes and furniture, spend large amounts on exterminators and cleaning products, so to get rid of something that only exists in the mind. The conviction is so strong that, even in the face of repeated negative exams, patients accuse doctors of incompetence or even covering up the truth. There are reports of people collecting small fragments of skin, fabric, fibers, and dust, bringing them in jars to medical appointments to prove the infestation. This behavior is known in psychiatry as the matchbox sign. Treatment is challenging because most patients reject the idea that their problem is psychological. They seek dermatologists, infectious disease specialists, any specialist but a psychiatrist. When treatment is accepted, it usually involves atypical antipsychotics and cognitive behavioral therapy. The approach aims to reduce the intensity of sensations and deconstruct the belief in infestation. Trust between doctor and patient is essential. Without it, the patient may quickly abandon therapy, returning to a cycle of despair and self-harm. Ekbom Syndrome can also present collectively when two or more people share the same illusion. This phenomenon, called folie à deux, often occurs among very close relatives. In these cases, the shared belief strengthens the delusion. If one person feels and believes in the infestation, the other begins to feel it too, in a disturbing psychological mirror. The human mind has the power to create physical sensations from deep beliefs. And in Ekbom Syndrome, this capacity is taken to the extreme. This disorder reveals how much our perception of reality is shaped by the brain. What we feel does not always correspond to what exists. And for those living with this delusion, there is no difference between imagining and experiencing. The social impact is devastating. Shame, fear, and obsession consume relationships, jobs, and the mental and physical health of those affected by the disorder. Still, recovery cases exist. With proper treatment and emotional support, it is possible to reduce or even completely eliminate tactile and visual hallucinations. The path is long and demands patience. Ekbom Syndrome reminds us of a disturbing truth. The mind can become its own prison, capable of generating pain and sensations that need no external agent to exist. And, in the end, the most disturbing question is if our senses can deceive us this much. Did you like the content? Leave your like, comment, and subscribe to the channel so you don't miss more mind fragments, where we reveal what many prefer to ignore.